We're bringing you some health news now. With over 100 confirmed Ebola cases, the virus outbreak is now leading to not just health but also economic concerns in the Central Africa region. The concerns come as authorities intensify efforts to contain the outbreak of the rare Bundibugyo strain of Ebola. Traders and residents in the eastern Congolese city of Bunia say the virus outbreak is beginning to disrupt supplies and trade. Several merchants warned that transport restrictions and border measures were affecting their business and daily survival.
This is my last stock and I do not know where I am going to go to restock. In any case, the government must find a solution for us from this disease, this virus that is putting us all in chaos.
Meanwhile, Uganda has closed its border with neighboring Democratic Republic of the Congo with immediate effect to try to limit the spread of Ebola. The government said the border will be closed for 4 weeks, except for Ebola response teams, humanitarian and security operations, and food and cargo transport. Eastern Congo depends heavily on cross-border trade with neighboring Uganda and Rwanda, particularly for food products and consumer goods. Over in the United States, Secretary of State Marco Rubio has said U.S. cannot allow any Ebola cases to enter the country.
Number one priority of our foreign policy is to protect the American people. We cannot and will not allow any cases of Ebola to enter the United States. And so the State Department and other agencies represented here, the Centers for Disease Control, HHS, others are working very, very hard to contain this crisis to the countries where it's currently located, particularly the Democratic Republic of the Congo.
The US CDC last week imposed entry restrictions for 30 days on travelers who have been in the DRC, Uganda and South Sudan in the past 21 days, including lawful permanent residents. It is also screening people traveling from those countries at 3 US airports. Reports say US officials are in discussions with Kenya to establish a quarantine facility for American citizens exposed to Ebola. However, the proposal has raised concerns among residents in Nairobi.
Why do Americans think that their lives are so much important than the lives of Kenyans? So that they establish a facility in Kenya that is meant for only Americans. If they must be allowed to open that facility here, then it must be a facility that serves every human being in Kenya, Kenyans and Americans alike, but not restricted to quarantining only Americans.